20 million Americans are now eligible for a Pfizer COVID-19 vaccination booster shot. The CDC gave final approval Friday for a third shot for 3 groups: people 65 and older, adults at high risk of disease, and those at increased risk of exposure because of their jobs. The agency's guideline follows the FDA's decision about booster shots. In a rare move, the CDC director went against the recommendation of her advisory panel, which did not include the so-called frequent exposure group in its recommendation. CBS News' Michael George has more on the booster shot rollout.
We are ready to get booster shots in arms right away.
The White House task force prepared and was ready to give out doses to 20 million eligible Americans even before the CDC gave final approval Friday.
As soon as I heard about the boosters, the only thing I wanted to know is where can I get it?
The Texas State Fair obliged. Boosters and first and second doses will be available there for the next 3 weeks. Anyone 65 and older who's been fully vaccinated with the shot should get a booster after at least 6 months. The CDC also recommends a booster for fully vaccinated 18 through 64-year-olds who work in healthcare or other jobs with an increased risk of exposure, like schools and nursing homes. And all vaccinated people with medical conditions, including obesity, diabetes, or pregnancy, are also eligible for a booster. At the White House, the president indicated it won't be long before boosters are available for everyone.
We have the tools to beat COVID-19, if we come together as a country and use the tools we have.
But the coming together may be the hard part. Deaths this week continued at a rate of more than 2,000 people a day.
I want to be clear. We will not boost our way out of this pandemic. Infections among the unvaccinated continue to fuel this pandemic.
In Montana, where just 48% of the population is fully vaccinated, students at the State University in Bozeman were still arguing over masks yesterday.
I simply disagree that safety is better than freedom.
Oh, I don't want to wear a mask, I'm vaccinated, what's the point? But now when you see the spiking rates of COVID, especially with hospitals being filled right now, I think it kind of, by not wearing a mask, you're just undermining everyone else's well-being.
Montana saw a 66% spike in cases in just the past 2 weeks. Michael George, CBS News, New York.
Dr. William Schaffner joins me now. He is a professor of infectious disease at Vanderbilt University Medical Center, and he is also a member of the CDC Advisory Committee on Immunization Practices. Dr. Schaffner, it's so great to have you. As I mentioned, you are part of that CDC advisory panel, as I believe that actually decided not to include the frequent exposure group in its booster shot recommendations. Tell us why the committee made that decision.
Well, there was a split decision, right? There were people who did indeed favor that. The committee decided not to do that because still these vaccines are very effective in keeping you out of the hospital, in preventing severe disease. And they just thought that this was not the optimal time to expand the booster program quite as widely, because the vaccines still continue to do their job very well, except in those specific populations that they designated. Dr. Walensky decided to open things up a little bit more.
Do you agree with her decision to overrule the committee?
Well, I'd like to think about it as expanding the ruling of the committee rather than overruling it. And actually, I'm very sympathetic to doing that. I think there are many people who are ready to receive the booster dose, and I'll bet there are people today already going to pharmacies and vaccination sites around the country asking for their boosters. While we're doing that, let's key on the other message that Dr. Walensky had. We have to keep vaccinating the people who haven't had their first dose yet. That's where the real problem is. The virus is spreading in that population primarily.
Absolutely, but it is a much bigger lift to try and get that group who is opposed to getting even their first vaccination, as opposed to people who are hoping to get their booster shot. I have to take advantage, though, of having you here, having that perspective of actually being inside these committee meetings. Can you tell us more about what goes on inside those meetings as committees like yours are evaluating what is very much a fluid situation here in the United States?
Well, fluid is correct. We're constantly looking at the data, and I would emphasize that all the discussions that take place are based on the science. The science is examined with great criticism and very, very critically. And then there's a discussion. You know, when you translate science into public policies, there's not a single correct answer. There are a number of different ways you can do it. And that was the essence of the discussion that went on.
That's a very helpful way of thinking about it. That scientific language almost as a foreign language to the lay population. The FDA and CDC now say that people 65 and older, high risk or frequently exposed to the virus should get their third Pfizer booster shot 6 months after their second shot. I want to ask you some logistical questions that may be on our viewers' minds. Why 6 months? Can people get it earlier than that, or is there a problem if they get it too soon?
You'd not want to get it too soon. You want the immune system to mature sufficiently so that it can really give you the boost response, which raises your antibody levels very high. That takes a little time. Don't do it too soon. Wait till 6 months at least, and then get your booster, because then it will be maximally effective.
There are also millions of people, though, who got the Moderna or the Johnson & Johnson shot 6 months ago. Can they get the Pfizer booster shot if they're concerned about their vulnerability?
Well, that's called mixing and matching, starting with one company's product, finishing up with another's. That's not recommended yet because we haven't seen the data that say that that will be satisfactory. So we'll have to wait a little bit. The Moderna company has submitted its information. The J&J people are behind Moderna. They will submit their data. And as each comes up for discussion, the recommendations will be revised.
Do we have a sense of timeline for when those are going to be considered?
It's always the top question. When can we get our booster? So I think we'll just have to wait. It takes the Food and Drug Administration some time to look at these things, and then the CDC's committee will meet as soon as possible, right after the FDA makes its decision. I'll try to look in my crystal ball and say it will take at least a month and maybe a little bit longer before we hear about Moderna. But we'll wait and see.
All right. Well, good to know. At least a month. It gives people something to hang their hat on a little bit. I want to also ask about the other timeline that I know parents like me are anxiously anticipating, when that pediatric vaccine might actually get rolled out and approved for children.
Yeah. So we all recognize that 12 and older, we have a vaccine available for them. We have vaccinated about 40% of those adolescents. We need to do even more. And the next group are 5 through 11 years of age. Those data have been submitted to the FDA. The FDA is looking at them. It will go to their committee and then ours. And we hope that that happens within several weeks. Again, maybe within a month. That would be very, very good. There are lots of parents who are eagerly awaiting providing that protection for their younger children.
Absolutely. Dr. William Schaffner, always appreciate you coming on the show. Thank you, and thank you for all that you do.
My pleasure.